Hi there, I am Jala Gupta. You must have read my introduction in the first page of my webinar. So today's topic is the evidence-based study on the physical activities for the obese children. Now, various researchers says that there has been a rising prevalence of childhood obesity and it is a concern for every parent. But this can be due to hereditary, or this can be either due to the bad eating habits of children, eating junk food which the parents are not taking care of. So in Western countries, basically this activity is discouraging the society of obese children, and this obesity is carried on to the adulthood, leading to various cardiovascular problems, vascular issues, or the issues related to your liver, leading to fatty liver, increased cholesterol, and sudden heart attacks in young adults. This may be because of the childhood obesity. And the rising prevalence is seen in the Western society, which discourages the physical activity by decreasing the opportunity to expend energy. They are not focusing on the children that they should follow a proper physical regime, which is actually based on the guidelines for children that they should follow. So in this webinar, I'm going to tell you that what are the evidence-based studies which says that what all activities are good for children as a whole, and how much activity they should do to maintain their physical health perfectly. Specific examples include the predisposition of type 2 diabetes, and in turn leading to risk factors for CVD, asthma, sleep apnea, and impaired mobility. Being overweight and obese results from an energy imbalance. When there is energy imbalance if you are having energy imbalance, that the intake of energy from the food is not balanced with the physical activity that you are doing. If this is not balanced, this will lead to the obesity and diabetes mellitus. Physical activity has direct relationship with the healthy weight status of children through higher level of energy expenditure. Lower level of physical activity are typically associated with the increased risk of cardiometabolic and vascular diseases and diabetes mellitus. Basically, diabetes mellitus is commonly a hereditary problem, but in cases children are focusing more on the sugar food, they should not consume more of sugar food, then it can lead to the diabetic issues in young ages also. The physical activity is it is important to encourage both the normal weight and overweight children to increase their level of physical activity and exercise and reduce their sitting time to avoid excess weight gain associated with the health risk. One study says that the cardiovascular mortality was lower in individuals with higher BMI and good or aerobic fitness, and vice versa. So this seems that if you have a good aerobic fitness and your BMI is more than normal, then also you will be fit in relation to your heart issues. So it's very important that you are physically fit and you are doing the exercises at your regular pace. Physical activity, it contributes to greater bone density, reduced clustering, CVD risk factors, and improvement of the body composition, and it assists in management of the weight gain. Now, there are healthy children which will benefit from an even greater volume of regular exercises than adults. So it is not like that adults has to do more exercise. No, it is that children also has to do more exercise than adults, and because they are young, so they can cope up with the exercises. Recommendation for children is if they do 20-30 minutes of exercise, aerobic exercises or strength training 2 to 3 times a day. Say for example, parents said that for 2 to 3 times per week they will be doing for 30 minutes aerobic exercises, and for the next alternate week they will be doing the strengthening exercises. So both are good for children. And actually it has been said that the physical activity, it's result in an increase in energy expenditure due to the cost of activity itself. It is hypothesized to increase resting metabolic rate. When you're increasing the resting metabolic rate, this lead to energy expenditure and decrease the likelihood of the positive energy balance in children. Studies, they have reported that significant increase in strength in prepubescent boys and girls after isotonic strength training. So you can either do isotonic or isotonic in children. Basically, isometric is not recommended for children because they are small. So isotonic is good exercise strength training in case of children. And also it has said that the strength training may retard the rate of acquisition of visceral fat mass in growing obese children. Also, the majority of strength training in children of more than 8 weeks, they report no muscular hypertrophy. So parents don't have to worry that, okay, if my child is doing strength training on alternate weeks, they will suffer hypertrophy. Even if your child is doing continuous for 2 months the strength training, isotonic muscle strength training, the hypertrophy in the musculature is not seen, so that's not to worry about. Now, the studies children have reported that kinematic changes in the spatiotemporal parameters, so the walking, the cadence, the stride length and the swing phase duration has been changed in case of the exercises. Also, the ankle motion is greater in case of dorsiflexion and lesser magnitude in plantar flexion in case of obese children. So this need to be improved if you are referring to a physiotherapist for the exercise program for children. The kinetic analysis in the present studies, they provide information regarding the gait pattern displayed in the obese children during walking. The hip is the only joint that is affected in the obese children. So the first difference is the articulation is at earlier transition from hip extensor energy generation to hip flexor energy absorption. So therefore, if this is there, then the mechanical energy generation by the hip extensors is decreased and the energy generation and absorption by the hip flexors is increased. And as we all know that from the metabolic point of view, the early shift to an eccentric hip flexor contraction could turn out to be beneficial in case of obese children, because the eccentric contraction, it is lower than the concentric contraction energy metabolism, which is required for the eccentric contraction. It is lower than the concentric contraction. So anyhow, it is beneficial in case of obese children. A regular physical activity program include the mixed aerobic strengthening training or for 30 minutes and 3 times a day, 3 times per week is beneficial for obese children. It reduces the abdominal adiposity, increase the fat-free mass and reduces the cardiovascular respiratory problems in case of obese children. So this is very important that we as parents take care and decide the physical parameters. If our child is obese, this has to be taken care of at an early stages. The obese adolescents have shown to significantly decrease their energy intake during lunch and dinner after a single bout of high-intensity cycling, and 70% VO2 max has been noticed. But the appetite sensations, now if your children has appetite sensations as normal to the normal children, it's completely okay, but basically the point is that the resting metabolic rate should increase and the children should take lower lunch and dinner. So parents should not force their children always to eat more and more. If they are consuming normally, then it's okay. Don't force them, because we are the parents who actually increase the diet of our children. Do not increase the diet of your children. Just if they're eating normal, let them eat what they are eating, right? Do not force that eat 1 more paratha, eat 1 more chapati. No, this will lead to obesity and this will increase. Actually, the thing is that it is a fact that if we are increasing the diet of children, the children will have that habit. So if we are not forcing the child, if the child is consuming normal food, normal intake, let it be that way. Do not force the child to eat more. The child will eat more if you force slowly and gradually. But anyhow, you are increasing the stamina of eating, consuming the food, which will in turn lead to obesity. So this is said by researchers that let them eat according to their body. Do not force them to eat more, right? Some mothers are very possessive. No, eat this, eat more, eat more, eat more, eat more. No, this is wrong actually. Let them eat according to what they are eating. Yes, we have to be focused that they are getting fully nutritious diet and some way or the other, but do not force them that to eat 1 more chapati, 1 more paratha, eat more chicken, eat more bacon and everything. No. Now, exercise reduces the resting systolic BP in moderately obese children and is effective treatment for control of BP in children, and this reduces the coronary artery disease risk to 9% due to the increased endothelial nitric oxide synthase activity. Whenever we are doing the aerobic exercises, we are working on the heart muscles, right? And this has seen that it increases the endothelial nitric oxide synthase activity in children and decreases the insulin sensitivity. Specific improvement on the executive function and brain activation changes due to exercise were observed, and the children mental functioning was improved, and they were more able to grasp things mentally than in the subjects who were not doing the exercises, whether they are obese or not. Now, the aerobic exercise is also associated with significant reduction in the visceral adiposity, intrahepatic lipid, and improvement in insulin sensitivity, and it reduced the abdominal adiposity in children. Aerobic exercises, rather the resistance exercises, is good for them because their muscles will work more, but the aerobic exercises is good for their heart as well. It is good for their reducing the adiposity, insulin sensitivity, and the fatty liver. Now, in obese children, the exercise training showed improvement in the endothelial function and increase in cardiorespiratory fitness. Also, energy training induces changes in the FMD. It is postulated that repeated exercise exposure results in upregulation of nitric oxide dilation system. So it is good for children to do the aerobic strengthening training along with the resistance exercises. So we can say like for 2 weeks aerobic, 1 week isotonic strength training. Now, one research is very important which says that the fats, carbs, and proteins, they represent the major fuel of the tissue and the circulating system. Along them, the glucose represent the most important caloric source directly able to modulate blood glucose control, although its caloric support is lower than that of fat. During glucose load, there is increase in blood glucose level, and which in turn it stimulates the pancreatic release of insulin, which in turn promotes the peripheral disposal of glucose, especially the skeletal muscles, promoting the GLUT4 receptor mediate uptake. And during exercise, the increased glucose demand activates the complex hormonal responses which modulate the insulin levels, and it counter-regulatory hormone release, glucagon or catecholamines or GH and cortisol concentration. These hormones, they actually operate in two ways. The first way is that during early phase, there is decrease of insulin level, there's increase of the epinephrine and glucagon, which in turn it lead to local relative increase in the insulin level and then increased blood supply to working muscle. So first there is a decrease of insulin level, then there is increase in the insulin level and increased blood supply to working muscle. But if we are doing the prolonged physical activity, this will in turn lead to increase of the glucagon and cortisol and the growth hormone and promote metabolic changes later in the time. Also, during the different phases of exercise, the hormones modulate fuel metabolism by activating the hepatic glucogenesis and glyconeolysis, as well as muscle glycogenolysis, and improving the adipose tissue lipolysis, stimulating the muscle glucose uptake through recruitment of insulin and dependent GLUT transporters in the muscle. And when the child is at rest, the free fatty acids are the main fuel which is utilized by the muscle basal metabolism. Now, during sports activity in children, the energy demand to muscle by circulating free fatty acids is there, and the muscle triglycerides, muscle glycogen, blood glucose, derived liver glycogen. The properties of this substrate is that they are burned and adjusted according to the demand of children, their physical demands, their energy consumption demands, that is to the intensity or duration of the activity. And during severe and prolonged activity, there is greater reliance on the fuels from outside the muscle, including plasma free fatty acids and the blood glucose level in children. This has been reported by one of the study, and the shorter exercise, greater the utilization of muscle glycogen stores. Now, moving to the diabetes mellitus, right? The children who suffer from diabetes, they have frequent exercise hyperglycemia and ketosis. Now what the parents need to do for this is that for children who have diabetes mellitus, they still continue till adulthood, right? So in DM, there is increased blood glucose levels, and during and after physical exercise, if DM is not controlled, and glycemic level before exercise represent one of the most important factors influencing the risk of hyperglycemia. Now, if the exercise is started when the blood glucose is higher than 250 mg per dl, and ketones minimize the occurrence of sports-related adverse effects, then there are interventions which should be maintained and made on individualized basis, right, and on the individual specific response to particular activity. The American Diabetic Association says that keeping blood sugar in case of obese children either 100 mg per dl and under 250 to 300 mg per dl for people with DM who decide to practice physical activities. And before starting up the physical exercise, the guidelines suggest that delaying the exercise if blood sugar is above 300 mg per dl. or not ketones are present. Even if the ketones are not present, then also they should delay the exercise, right? It's not like if you do the exercise above 300 mg per dl, your diabetes is above this, then your diabetes will reduce. No. So better is that you consult a physiotherapist before starting off with your exercises in case of diabetes, especially in case of obese children, and diabetes in case of non-obese children, right? As insulin demands are substantially different during exercise, overall individual experience must be collected in order to determine the individual glycemic variations. So the glycemic variations is different in each of the child, right? It depends from individual to individual. So it is advisable to check the blood sugar 1 hour before and 30 minutes prior to any physical activity, whether you are doing the aerobic or whether you are doing the isotonic strength activities. And to identify a trend of blood glucose sugar going down to 150 to 90 ml per dl, or possibly up 150 to 60 mg per dl, to adjust the insulin or to diet before or after exercise properly. So we have to maintain a balance between the child diet, the child physical activity, and the child glucose levels in the body. So monitoring the glucose level is very important. We cannot go through the fact that if the child is having high sugar levels before starting up with the exercise, the sugar might drop after exercise. No, the child may actually may not cope up with the exercises and later may faint, right? Even in the high glucose levels. And also in case of high glucose level, there are fluctuations of the glucose because the insulin is not maintaining properly. So if we are actually guiding the child to do the exercise in case of low glucose level, they can lead to high glucose fluctuation immediately after the exercise. So from extreme low to extreme high, and from extreme high to extreme low is possible in case of DM if the child have frequent fluctuations in case of diabetes. It is very necessary to regulate and monitor before 30 minutes, and while doing the exercise, just take a break and monitor again your blood sugar levels, because you might not know what changes our body undergoing after the exercises. Yes, exercises are very beneficial in the long run, but when there are more fluctuations of the blood glucose level, this should be taken care of. So this is all about the evidence-based study on for the obese children in case of diabetes mellitus, or journal health that has to be followed, journal physical activities that has to be followed. So just take care of regular activities and exercises. Also just take care of your obesity. It is not good, and parents should not force their children to eat more and more and more. Just let them eat. But yes, if they're eating less, this is a concern point. Point is that you as a parent should know that my child is taking a fully nutritious diet or not, right? So bye bye, take care.